All right, so thank you everyone for joining us for this webinar, which is the first in a series of 12 covering reports from the N8 Research Partnership, the Child of the North Group, and the Center for Young Lives. I'm Mallory Moorhead. I'm the program manager for Born in Bradford's Center for Applied Education Research, also known as CARE. And CARE is playing a key role in coordinating many of the reports in the series. So just to start, a reminder of why we're here today. We know the number of autistic children in the UK seeking support has reached a record high. We also know there's an autism assessment crisis, which has worsened since the COVID-19 pandemic, leaving many children and their families without needed support. The system needs changing and solutions are needed now to improve life outcomes for all children and young people. Today, you'll be hearing a range of presentations related to the Autism Report, which highlights challenges and issues, but also offers hope and solutions. So soon you'll hear an overview of the report and the 2024 Child of the North campaign. You'll also have a chance to hear more about the key recommendations laid out in the report, and our presenters will be discussing autism-related inequalities, how schools and educational psychologists can better support children with autism, and you'll hear about an oral health intervention for neurodiverse children and young people. So please note that following the presentations, we do have a number of questions that were submitted by schools previously that I will be posing to the presenters. We likely won't have time for Q&A during this webinar, but please feel free to submit any questions to the CARE Bradford Gmail account, which is caerbradford@gmail.com, and I will pass on the questions to the presenters. And without further ado, we do have a packed agenda, so I'd like to get started with our speakers. We have a fantastic lineup today, starting with Dr. Megan Wood. And Megan is a postdoctoral fellow, research fellow at University of Leeds, who will be providing a report and a campaign overview.
Thank you, Mallory.
Mm-hmm.
So, hi everyone. So as Mallory said, I'm Megan, and I'm going to be going through an overview of the Autism Report and the wider campaign that this is part of. So this is part of a Children First government campaign over the course of 2024 and beyond. And ultimately, we are trying to create a country that works for all children and young people. So I think this is captured really nicely, and this is from the Centre for Young Lives, who's one of our partners. And essentially, isn't this what we all want? We want Britain to be the place, the best place in the world for children to grow up and to bring up our children. And this is a huge campaign. So as we've already said, it's part of the N8 Research Partnership, the Child of the North, the Health Equity North, and Centre for Young Lives. And as part of that, all our partners and collaborators, including a whole range of academic institutions, partners, schools, etc. So over the course of 2024, we are making the bold bold aim to release 12 reports. And these are going to be, as part of the campaign, these are going to be launched every month. And every month we have a key priority area that has been selected, working with our key stakeholders. So practitioners, education, people working in education, policymakers, and the people who ultimately it's going to impact. And these are only just scratching the surface of the topics that we could have included, but these were the 12 priority areas that were selected, and these are the priorities that government should consider to put forward a child-first government and make sure that we are putting our children and young people at the forefront of policies going forward. And as you can see here, autism is number one, with 11 more to go. So hopefully this is something that you've now seen and are familiar with. And this is the front cover of the Autism Report. And I think something that is really key to this report is that we are really trying to drive a solutions. Oops. Sorry, could you go back one, please? There we go. That we are trying to put forward a solutions-driven approach. So many times before, there have been reports being released that just state a sad state of affairs. And these are issues that we all know, we're all aware of, but what we actually need is, what can we do about these problems? What can we actually do as a society? What can government do to actually make concrete changes to help our children and young people? And this is something really unique about this series of reports that we are due to release. And importantly as well, is that, as why I've circled it here, is that these are evidence-based recommendations. So everything that we put forward in all these reports is backed by robust science conducted by our by leading experts in the field across the country and beyond. And we're also co-producing this work with the people who it actually impacts. So we're getting that real life experiences to influence the research that is being included. And something that I think is something that we're very proud of as well is that this first report has had a huge impact already. So this is just a little bit of the media interest that has been sparked already. And something that's particularly nice is that the day after the launch of this report, it wasn't old news. There were still stories coming out and media attention coming out for days afterwards. So hopefully this is something that people are going to continue to talk about, and we are hopefully going to create a buzz around this that government simply can't ignore. We want to get this buzz continuing and essentially make sure that government are actually going to do something about it. So as I said, this is I'm sorry, I got disconnected then. So this is the first report of 12. And here we have a QR code, which you're free to scan and sign up, which I know is going to be also included in later slides. But here you can receive future reports and spread the word, essentially. And together, hopefully, that we can actually drive change for children and young people in the UK.
Thank you, Megan. And next we'll hear from Evie Shore, who's a Research Implementation Fellow with CARE, and her core project focuses on neurodiversity support within schools. She's also a psychology student at University of Leeds and was one of the lead authors on this report. So Evie will be presenting now the 3 key recommendations from the report.
Thank you, Mallory. Yeah, so this report, as well as the upcoming 11 reports, all make 3 evidence-based recommendations. As Megan said, there's a wide evidence base backing up all the recommendations that we're putting forward in these reports. So these recommendations focus on shifting the way that we're thinking and the way that we work so that we can better support autistic children and young people. So in this way, our recommendations focus on what can be done now with the resources that we have. Yeah, so I'll move on to the next slide. And so our first recommendation focuses on building partnerships between education and health. We know that the support systems for children and young people are currently disjointed, and that the information that we get from education and the information from healthcare currently aren't being used together to complement each other in the way that they could be. And the evidence shows that autism assessments can be effectively conducted in educational settings, and that routinely collected educational data, such as that from the early years foundation stage profile, can help identify those children and young people that are at a high likelihood of having undiagnosed autism. And so these two systems are already really well positioned to support one another. And that's why we make the recommendation that formal partnerships should be made between health and education to ensure that autistic children and young people have a robust network of support that wraps around them. And then that will take some of the pressure off young people and their families in navigating what can be a really tricky pathway to accessing support. And one way that we can start to facilitate this collaborative working is through connected data. So we suggest that using UPNs or unique pupil numbers across health and education will allow these services to have that common denominator that they need to share data and work more collaboratively to get a holistic understanding of children's support needs. So our second recommendation is around continuing professional development courses. So you know that we need more awareness of what reasonable adjustments can be made to make environments more neurodiversity friendly. And so we recommend that these continuing professional development courses be continued and extended upon for both health, education and social care professionals. These courses should raise awareness of how autism presents differently in girls and ethnic minority groups, as we know that they face additional barriers to accessing support. As Megan also said, that this report showcases the voices of children and young people, and that's something that should be happening across the board. And so we suggest that these courses should be co-produced by people with lived experience, as they're the experts at telling us what it is that we need to know and what we need to be doing. And these courses should not only be delivered to current professionals, but also those that are currently in undergraduate training. Our final recommendation focuses on how we can best support our most disadvantaged communities through collaborative partnership working. We suggest that our most disadvantaged wards should be prioritised to trial whole system approaches to addressing inequity, whereby schools, businesses, faith, health and education settings all come together to deliver support. Because compared to on their own, as a collective, these organisations have the power to make a more impactful difference for autistic children and young people. Again, the key for this to work is co-production, whereby we get in the communities and families to all contribute to ensure that these approaches are tailored to the needs of each and every place. Thanks, Mallory.
Thank you, Evie. And next we'll hear from Dr. Leanne Rogan, and Leanne is a practicing clinical psychologist who completed her DClin work at the University of Leeds.
Thanks, Mallory. Yeah, hi everyone. I'll just try and move this along. Yeah, I'm Leanne Rogan, and I was lucky enough to do my my doctoral research project with Mark Williams and the Connected Bradford team, and that research was looking at inequalities in access to autism diagnosis and support for girls, and that's what I'm going to talk about today. We're quite limited for time, so I'm not going to talk about too much about kind of what we did, but I'm going to focus straight in on kind of what was important, and that is the lived experiences of girls and women and parents across the district. But before we kind of move on to that, our starting point was to use that connected data, the health and education data, to look at what those inequalities look like in Bradford specifically. And what we found was that the sex-based rates of diagnosis were 4-to-1 in Bradford, which is higher than what we see nationally, around kind of 3-to-1, and suggests that there are large numbers of girls that are going undiagnosed and not having their needs met. If you're a boy in Bradford, you're 3 times more likely to be diagnosed, and the girls that were diagnosed later than boys. So we had this information, but what it doesn't tell us is why and how this is happening kind of on the ground. So we spoke to to autistic girls and women and parents of autistic girls across Bradford to try and understand their experiences and try and make sense of what we're seeing in the data. So I'm going to talk through that now. And I guess the first challenge that came up was correctly identifying needs in the first place. And the theme that came up was that actually needs were being identified, needs were being seen, but they weren't being connected with autism. So many of the girls had kind of co-occurring conditions such as anxiety, sensory processing, developmental coordination disorder, and these were identified, but they were kind of identified as a primary difficulty, and the kind of underlying autism just was not being seen. Those diagnoses were being used as kind of a coverall to explain everything. And there was a sense of autism just kind of not being on the radar. We kind of socialized into seeing the stereotypical male presentation of autism. So when these needs were popping up, people just weren't connecting that with potential autism for girls. The girls and women that we spoke to described noticing differences between their kind of academic ability and their social skills when they were younger, which was kind of a barrier in terms of schools identifying need because they were attaining academically, so they weren't being kind of flagged up as a needing support. But the girls kind of recognised that difference in themselves. They talked about kind of experiencing more difficulties with changes to routine and sensory processing. Socially, they were kind of able to make friends, but the difficulty came in maintaining those relationships. But that kind of ended up in them looking like a bit of a social butterfly and jumping between different friend groups. But actually, the kind of difficulty maintaining relationships was underlying that. So that difference also led to masking. So being aware of that difference and kind of wanting to fit in with their peers. And they spoke about kind of observing and copying behaviours in order to fit in. And for some people, that was a conscious decision. And for others, it wasn't. It was something that was just kind of developed over time. And of course, that masking led to further delays in being identified because of that limited understanding across the system of masking and what autism can look like for girls. Where needs were identified, or where kind of autism was maybe starting to be thought about, there were further barriers to accessing support. So parents talked about seeking support from school, but because the difficulties weren't being observed in the classroom, then their concerns were dismissed. And there was no kind of action on what they were reporting, and that led to kind of delays in SEN support. It also led to delays in kind of referrals to health and assessment services, because we know health services are majorly underfunded and under-resourced. They're working quite rigidly. So for the girls that were referred to health services or for an autism assessment, they were discharged if school weren't providing that supporting information. For girls that did move through into health services, the limited understanding of autism or being able to kind of identify that posed another barrier. And people, they talked about kind of people not putting the puzzle together. So things were being identified as little pockets of need, but not seeing that kind of autism. So for example, experiencing anxiety and then being recommended CBT for social anxiety, but not kind of thinking about what might be underlying that. Another thing that came up was missed opportunities. So particularly for kind of older girls and women who began to kind of think about autism for themselves and recognize that and taking themselves to the GP to explore that. And again, that kind of limited understanding meant that people were, again, either kind of dismissed and made to feel silly for pursuing that. Some people were actively discouraged from seeking an assessment, indicating a lot of stigma around that. So recommended to go for private assessment so that it wouldn't show on their NHS records. So there was a lot of kind of stigma attached to that. The parents and the girls and women we spoke to did talk about kind of the training for health and education staff, and that one of the barriers to that kind of knowledge and skill to be able to identify is that training packages at the moment are more likely to just train people up in being able to recognise what we what we see is a kind of the stereotypical presentation and not the nuances of how kind of girls can present. So even if they do access training, it's not necessarily going to be helpful as it stands. In terms of routes to support and the experience of assessment, there were different routes to getting an autism assessment. There was not one cohesive pathway, so it was very unclear, it was very uncontained. There were people who were referred to for an assessment, for an autism assessment specifically, but there were people who maybe sought an assessment as an adult when their child had been diagnosed and they were recognising things in themselves. So it was kind of, people talked about it being very bitty and very messy. When they got to the kind of the assessment stage, we talked about the kind of the limits to the tools and the assessment measures that are used, and how actually they are not necessarily appropriate. So thinking about things like the ADOS, which are quite stimulus focused, and thinking about responses to stimulus. And for girls and women who have developed masking skills over a long period of time, they're likely able to kind of to respond to that stimulus. So I talked about it really feeling daft is how one person described it, and that it would have been better to talk about their experiences, and yeah, experience-led assessment rather than response to stimulus. And parents talked about kind of support being accidental rather than it being a robust framework of support around a child and family. It was accidental, just finding somebody who understood and was able to help. But largely it was about being the angry parent, so really having to push and advocate and find workarounds to get support for their daughter. And some people needing to seek private support because they just couldn't access it through other channels, which led to financial strain and emotional strain. The impact of the delay was really significant. So the girls and women described the kind of mislabeling, so lack of understanding from people around them, lack of empathy, lack of support, and trying really hard to kind of mask their way through it and cope while they're not being understood, which inevitably kind of led to mental health difficulties and that kind of lifelong implication. And for some of the women we spoke to, they reflected on feeling like they hadn't reached their full potential. So they were very academically able when they were younger, but their other needs were not met, which meant they felt like they kind of underachieved. And for parents, that continuously having to kind of fight and battle for support was really significant in terms of their own mental health. And some parents described kind of feeling suicidal and feeling blamed by the system for their daughter's experiences and being sent on parenting courses and thinking about their own relationship with their parents. So just not recognizing the autism and actually feeling blamed. I guess the key point from these findings is that there's a narrative that girls tend to kind of fly under the radar, but what we're seeing here is that that's not the case. That, you know, being diagnosed later is not a core feature of autism for girls. This is a systemic failure to kind of recognize that need, and the needs are being seen, they're just not being recognized kind of accurately, and the support is therefore lacking. In terms of what needs to change, there were kind of five key things that came out of speaking to the girls and women. The first one was around training. So that training needs for health and education professionals needs a complete overhaul, and it should be co-produced, which we've already talked about in earlier sections. It should be co-produced by people who have lived experience and can appropriately advise on what people need to know. The second was that parental concern should be identified, and that should be the first kind of, you know, trigger point for signposting and support. And yeah, the parents kind of need to feel listened to and recognize that they know their child. The next thing was needs-led support. So there are multiple barriers at kind of every stage of the assessment process for girls, which impedes kind of that access to diagnosis. But actually, if support was put in place without a diagnosis, then that would make things obviously a lot easier, and there might not be that need to kind of to go through that process. Again, reviewing the autism assessment process, of changing it to a more experience-led, age-appropriate assessment process. And finally, breaking the stigma. And this was around creating kind of neurodiversity friendly environments where people feel safe to be themselves, and therefore kind of increasing representation where autistic women can be themselves, and then girls growing up will be able to kind of to see that, and that would be kind of helpful in the longer term. Thanks, Mallory.
Thank you. Next, we'll hear from Sarah Wild. And Sarah is the head teacher of Limpsfield Grange, a special school for autistic girls. And she's worked in the education settings for over 20 years and has dedicated much of her time in her current post as head teacher to raising awareness of female autism nationally. So Sarah will be providing insights from the school and from her work.
Thanks, Mallory. Good afternoon, everybody. I'm describing myself here as a bit of a veteran, I think, probably. I've been doing this for a long time. I've been head teacher at Limpsfield Grange since 2012. And just to give you a little bit of an anecdote, when I became head teacher of Limpsfield Grange, I'm just trying to get a picture up, actually. I went to the local authority and I said, you know, it was a school for girls with emotional and learning difficulties. And I said to Surrey County Council, I think most of the girls here are autistic. And they said, girls aren't autistic, you're making this up, which was quite rude. But that was only 11 years ago. So the first thing I want to say is we have come quite a long way in the last 11 years. There's still obviously quite a distance to go, but actually, you know, we've gone from thinking, could girls even be autistic, to actually accepting that they're autistic, and now thinking about how can we structurally address some of the challenges that they face. So Limpsfield Grange is a special school. We are a school for girls who really can kind of manage the mainstream curriculum that you get in a mainstream secondary school, but just can't manage the rest of being in a secondary school. So we're for girls who are aged 11 to 16. We have a residential provision. I'm in my office at the moment. The residential kids are kind of milling about. I may be interrupted at any moment. They're also being quite noisy, so I do apologise for all of that as well. We're very lucky, I think, at Limpsfield Grange that, you know, actually what we've got here is a community of girls who have been identified by the age of 11 and have managed to get in here. So in lots of ways, they've kind of been handed a golden ticket. I would say on average over an academic year, we receive between 250 and 300 in-year applications for places, for spaces in years kind of 7 through 11 for girls who have just been identified and want to come to Limpsfield Grange, and we never have any space. So we know that there is a huge number of autistic girls out there who are really not managing in mainstream education, who really want to go somewhere else and experience a curriculum that's really designed with them in mind, and there's just no provision. As far as I know, Limpsfield Grange is the only school in the UK that is specifically designed for autistic girls, and I have a horrible feeling we might be the only one in Europe as well. When I do parent sessions, I run a parent session pretty much once a month. I've had people come from Hong Kong, the States, Nigeria, all over. So I think when people are looking for autistic female provision, basically Limpsfield Grange is what they come up with, and that's really not okay. And that is part of the structural challenge that autistic women and girls face, is that actually, you know, we've gone from not thinking female people can be autistic to actually there's just nothing for them. So now they're being identified, there's absolutely no support out there. I'm going to talk a little bit about what we do here. I don't think this is a blueprint necessarily for other people. This is just what we do here. You know, I don't think I'm an expert in anything other than being the head teacher of Limpsfield Grange. So we have designed our very own curriculum. We follow the national curriculum. We offer a small number of GCSEs, because what we've done is we've stripped out some of the GCSE subjects that we could teach, and we've created a subject called WACI, which is really important in terms of addressing those other needs that the girls have alongside their learning needs, that will really help them to function and be the best version of themselves in a neurodiverse, neurotypical society. So our WACI curriculum, it stands for Wellbeing, Achievement, Communication and Independence. And today I'm just going to talk to you very briefly about what we do in terms of wellbeing, communication and independence. We have designed this curriculum. It's taken us since 2016 and we're still working on it. We've effectively written kind of like an assessment framework, which basically talks about, you know, various different bits of how much do you know, how well can you look after yourself, What's your communication like? So that's not just communication in terms of the words you're speaking, but, you know, how well can you read a social situation? Do you know how to engage in a social situation? Because we believe that actually well-being is the fundamental block that then leads to you being able to communicate more effectively, and all of those things feed into independence. And that's effectively the way you've got to do it. You've got to start with well-being first. I don't think it's a surprise to anybody who works with autistic girls that actually, you know, quite often autistic girls have really high levels of anxiety. They have higher levels of anxiety than autistic boys, and autistic women have higher levels of anxiety than autistic men. You know, there are very anxious people. Quite often there are other co-occurring mental health difficulties as well. And so staying well is absolutely key, mentally, emotionally, physically, to being able to function as an autistic adult, and to trying to avoid those periods of autistic burnout that autistic women and girls seem to experience particularly. So in terms of well-being, it's pretty broad. We run our wacky curriculum for 2 hours a week from year 7 all the way through to year 11. So we give it a lot of time. We give it as much curriculum time as a GCSE. And we kind of have to start with understanding your own emotions, because when the girls come to us and they're 11, they basically think they've got 3 emotions, and that's probably happy, sad, angry. And what you're trying to get them to understand is actually, you know, you have a wider range of emotions than that, because then that leads into their being able to begin to understand the emotions of other people. And that's really important, isn't it? Because actually, I think, you know, autistic people can be very understanding of other people, but actually, if you don't explain how all of this works for somebody else, then actually you're putting them at a disadvantage. Relationships are absolutely key, 100%. So for the girls that come to Limpsfield Grange, sometimes, or nearly all of them actually, they've been at primary school, they haven't had any friendships, they know that, they know they're on the outside of social relationships with everybody else. Sometimes their relationships with their family isn't all that brilliant, you know, there's a lot of sibling tensions a lot of the time, you know, they don't know how to have peer relationships that aren't friendships. And then obviously as they get older, they want romantic relationships as well. So we have to spend a huge amount of time thinking about, you know, how do you form friendships? How do you form relationships? How do you maintain them? How do you end them? How do you repair them? All of those things, because actually, you know, this is really meaningful and important to these autistic girls that we have, because this helps their sense of belonging. Living safely online. Well, I don't even know if you can, to be honest. I think that's maybe an aspiration. So we have to do a lot of stuff on online safety, because actually when you're looking at the autistic female community, you are looking at multiple vulnerabilities. So, you know, being a black and white thinker, being sometimes quite kind of young for your age, believing what everybody tells you, means that actually if you're living online, you are really easy to manipulate. And that can lead to really quite serious things happening. And that's not just when you're a teenager or you're a young adult. This can be all the way through your life. So actually, you know, how can you be savvy online to protect yourself? And then obviously we cover all the normal things, like, you know, your physical health, your emotional health, how to stay emotionally healthy, mental health, and sexual health, which means that we do have to have really upfront conversations with the girls, because you can't assume any kind of knowledge. So quite often our sex ed kind of classes are quite meaty. They have to start, you know, we have to use real world language. We have to start where the girls are in terms of their knowledge. So sometimes that's quite high, sometimes that's really not very high at all. And we absolutely have to kind of tell it like it is, because if you don't do that, it leads to all sorts of misconceptions. And then really, that's really fundamental to what we do, because that then leads into being able to feel good about yourself, so that you feel that you are able to communicate. And that's all of the different kinds of communicating. So I think, you know, communicating with people that you know, how well do you know them? How old is this person? What is the context? All of those things. Moving on to kind of like communicating with people that you don't know, and the different social situations that you are meant to kind of engage in. I think as women, we have a really high bar, don't we, for being able to read a social situation. I think probably the social load in terms of how we're meant to engage with other people is pretty high. You know, women are meant to be empathetic, we're meant to be great listeners, we're meant to be intuitive, we are not meant to talk about guinea pigs all day. And actually, if that's what you want to do, that's quite tough. We do a lot of scripting here, so actually it's sometimes about giving students the language, like socially acceptable language, to kind of butt into a conversation, or how do you exit a conversation, or, you know, how do you tell somebody in a really nice way that you don't really get what they're saying, all of those things, so that people feel confident that they've got some skills and some tools to go out into, you know, neurotypical society and kind of deal with social situations. We don't run any social groups. I had this conversation with a parent today. They were like, what social groups do you run? And I was like, none, because society doesn't run as a social group. We have to do things in the moment as they're happening in real time, because actually that's how the world runs. So we do a lot of thinking out loud. We do a lot of questioning, you know, as well as delivering GCSE maths. So it's pretty tricky. And really what we really want them to be are confident communicators, confidently autistic, you know, really proud of themselves, really, you know, not shy or ashamed of who they are, because they need to go out into neurotypical society when they're older, and they need to tell people what they need and then make sure that people give them what they need. So nicely. So it's making sure that they feel confident to do that, and that they have the confidence to try things out in neurotypical society. Sorry, I've had a chest infection, so I've also got a bit of a cough. Bear with. If you feel okay and you're mentally, emotionally, physically healthy, and you have developed some really great communication skills, that then leads to your independence. And that's really about how much do you want to interact with the neurotypical world, and having an understanding of how that works. So we say to the girls all the time, you don't have to live in the neurotypical world, and it's up to you how much of it you do. But what you do have to understand is how it works and what the expectations are for you. Because actually, you go into a situation and you're surrounded by neurotypical people and you do something and they think it's odd or unusual, then you are going to be judged. And so it's about understanding. You know, you can go and do that if you want, but you just have to understand how that's going to play out. So we really, everything we are doing at Limpsfield Grange is about trying to make sure that they are as independent as possible, so that they can go and participate and they can have choices. Independence is about having choice, isn't it? It's about choosing the life that you want to lead, and not feeling constrained because society has a view about what you are or what you can and can't do. Because we want them to make a contribution. We want them to be, you know, the next generation of really fantastic autistic women who are out there saying, hold on a minute, neurotypicals, if you just do this, we will be really successful. And I think there are some really fantastic role models out there. I mean, Greta Thunberg is an absolute legend. You know, she's a poster girl for Limpsfield Grange. We keep writing to her to ask her to come and visit us. But, you know, she's really herself. She's really authentic. And actually, she's out there making a massive difference to how we think about the climate disaster that we're living through. So we're trying really hard to give the girls the skills, the independence, the communication skills, so that they can go out there and they can make a difference, and that they can live the life that they want to live. I appreciate that we are a special school, so, you know, we have slightly different pressures to mainstream schools, but ultimately we're you know, assessed under the same Ofsted framework, and there are targets around the performance of the students. We've just made some really big decisions about what we think is important, because we understand the students that come to us, and actually having 10 GCSEs is probably no use if you can't leave your bedroom or you're not very happy in yourself. So we've made some real choices about what we're delivering. And I think mainstream schools can do that a bit too. It just means that you've got to have some evidence for it, and you've got to be brave. You've got to make some brave decisions. But that's just what we're doing here. It's been lovely to talk to you all today. So thank you very much. Thank you, Mallory.
Thank you very much. Next, we will hear about the role of educational psychology in providing support and improving outcomes for autistic children and young people. And I will hand over to now to Professor Caroline Bond and Dr. Ray Fayette, who are both educational psychologists from the University of Manchester.
Thanks very much, Mallory. And it was great to hear Sarah's presentation there, because I'd like just to emphasise what Sarah said, that there's lots of great practice going on in schools, and there is lots of kind of really good work, and in mainstream as well as in specialist settings as well. Although obviously it is a challenging time for many schools at the moment, which I'll touch on in a minute. So I'm going to say a little bit first about the kind of context of professionals supporting education and diagnosis, and then I'm going to hand over to Ray, who's going to say a little bit more about the role of educational psychology. So obviously schools do have kind of wider professionals to support them, and there's kind of challenges and opportunities in that. And that's really kind of, I suppose, where we as educational psychologists fit in. We're not kind of presenting specifically about research, but more about the kind of the general context. And I think, as Leanne has already mentioned about the work going on in Bradford around the diagnostic pilot in schools, and we similarly have been involved in the DFE's early identification of autism pilot. And I think these types of approaches can really offer something to schools in terms of that kind of direct working together in relation to diagnosis, looking at what the local community might need. So in the DFE's early intervention pilot, there were schools that were in very different contexts who developed their own kind of models that were responsive to the sorts of diagnostic work that they wanted to be taking place. And I think those kinds of models are really kind of a very helpful way of thinking about how health and education can collaborate together. I'd also like to point out as well that, and it was mentioned on one of the earlier slides, that Anne Longfield had commented on the fact that you don't necessarily need a diagnosis of autism to get additional support in schools. And I know many people who are kind of watching this webinar will be aware of that, and that there are systems such as education, health and care plans and additional support in schools. And the Code of Practice of Special Educational Needs requires schools to actually kind of identify children's special educational needs early and then put support in place for those young people. And the areas of need under the Code of Practice aren't diagnostic needs. They're areas like sensory and communication, cognition and learning, social, emotional and mental health. So autistic young people might kind of fit one or more of those different categories. So I think it's important to kind of make it clear that you don't necessarily need a diagnosis to access support. But having said that, we're very aware that actually there are lots of demands on the education system at the moment, similar to the sort of diagnostic systems. There's lots of pressures on schools and funding is in short supply. So there are those challenges to navigate. And schools can also kind of access additional support, which is where educational psychologists and professionals in health, like speech and language therapy and occupational therapy, come in, so that we can hopefully kind of work together to be able to support schools through in a range of different ways. So people have talked a lot about training and individualized planning for young people. And that's certainly one of the areas where educational psychology would certainly fit in. And as trainers of educational psychologists at the University of Manchester, we're very keen that trainees, when they leave our programme, that they have a good knowledge of developmental psychology and that they have the skills to work with families and schools and young people themselves to actually help to develop more effective ways of supporting autistic young people in schools. So I'm going to hand over to Ray now, who's going to say a little bit more about the work that educational psychologists do.
Thank you, Caroline. So as Caroline said, educational psychologists are in an ideal position to support children and young people, including those with social communication differences and needs, their families, parents, carers, and their siblings, and their schools or colleges or educational provisions. We assess children and young people's strengths as well as their needs. We collaboratively develop outcomes and plan and review strategies in line with the Code of Practice. As some of you or all of you may know, the assess, plan, do, review, we get involved on those either in preparation for education, health and care needs assessment, or if the child doesn't meet the threshold, continually supporting the schools in the SEN register level, and actually also reviewing education, health and care plans. Notice that on that bullet point, some eagle-eyed amongst you would have noticed that I've used the phrase social communication difference rather than autism, because we as educational psychologists still support those who are on the waiting list, so waiting for a diagnosis, whether they're going to get a diagnosis or not, and also after the diagnosis, and as well as those children and young people who may not meet the threshold for a diagnosis, but are still presenting with needs. So to Caroline's point earlier, education, health and care plan and the code of practice isn't a diagnosis-led sort of support or legislation anyway. Secondly, we do provide, develop and deliver evidence-based and evidence-informed training to school staff about autism and co-occurring conditions. So how to identify children and young people with social communication differences, to put forward for an autism assessment pathway, and how to support, as mentioned, not just those kids with autism alone, but also those kids with autism and other co-occurring difficulties or conditions such as selective mutism, extended school non-attendance. I know that's not a diagnosis, but it's a difficulty or a challenge. Extended school non-attendance, sometimes on different local authorities, is known as EBSA, or emotional-based school avoidance or non-attendance. To other colleagues' point earlier, increasingly, I know Caroline has been involved in supervising research around autism in girls as well. So the training that we provide to schools are based on those evidence, and also other sort of co-occurring diagnoses such as ADHD, OCD, and others. Okay, and some educational psychologists as well are part of multi-agency teams in some local authorities. For example, here in Manchester, some educational psychologists work very closely with colleagues from CAMHS, speech and language therapists, specialist OTs, community pediatricians, to triage and assess children's social communication differences, and also provide post-diagnostic support for parents and carers. Some educational psychologists are also part of youth justice teams, again, working alongside occupational therapists as well as youth justice workers and speech and language therapists. Within this context, we conduct direct assessments of children and young people, as well as help them and actually youth justice team colleagues develop their practice of working directly with children and young people with social communicational needs, including autism. The last bit is probably one of the things that I should have said earlier as well, is that we are very, very aware that our capacity to conduct all of the work that I've mentioned and more is limited due to the nationwide shortage of educational psychologists, as a lot of us are aware. Thank you, Mallory.
Thank you. So thank you, Ray and Caroline, for that presentation. We will shift topics once more for our last presenter, and we will move on to the topic of oral health. We'll be hearing from Dr. Amrit Chauhan, which is, she is from the University of Leeds School of Dentistry, and she'll be presenting the toothPASTE project, which is an oral health intervention.
Thank you. I'm just going to check if, yeah, perfect, brilliant. So, a quarter of autistic children have tooth decay by 5 years old. We know that because of communication difficulties, some autistic children may not be able to tell us if they're in dental pain. Sensory differences may make toothbrushing extremely sensitive and sometimes painful. And the same things apply to sounds, lights, tools, and equipment that are used in the dentist. And repetitive and rigid behavior patterns can mean that introducing toothbrushing at a later age can be difficult. And the same applies to restricted eating, with a lot of children that I've worked with, for example, having a really high sugar or beige diet. These factors can be why research shows that autistic children find it hard to go to a dentist and attend regularly. Those that do are less likely than their peers to receive prevention. When we start to put these into costs, tooth decay is one of the most common reasons why children are admitted to hospital, costing the NHS over 50 million a year. But autistic children are also twice as likely to need a general anaesthetic in order to receive dental care. So when admitted to hospital for dental care under general anaesthetic, wider data has found that around a third of population experience pain, a third have sleepless nights, and around a quarter miss time off school. So there's clear evidence that poor oral health has a direct impact on school attendance, and this can really widen educational inequalities. So that's why a really common word that parents use to describe toothbrushing is a battle. We found parents report feelings of isolation and confusion. They felt that wider oral health advice is often generic and doesn't include autism-specific challenges or solutions. We also found that because of difficulties navigating the pathway and limited dental access, and often feeling judged at the dentist, parents would speak to other wider early year professionals across health, education, and third sector about oral health, including schools and nurseries. But our research also found that these professionals had limited oral health training, and while they acknowledged that oral health comes up within their roles, they didn't feel confident engaging in these conversations and were unsure of their advice. And that's where our research study called toothPASTE comes into play. So toothPASTE aims to develop an oral health support package to enable parents of young autistic children to be confident and empowered in looking after their teeth. What's at the heart of this project is that it's very much parent-led. We've engaged with a panel of 6 parents, all with lived experience, right from the start of our project. And they've made sure that anything that we have developed is what parents want, need, and what works for them as well. It's been a really rigorous research process underpinned by evidence-based behaviour change, co-design, and lived experience throughout. The research that we undertook has led to the prototype of the support package, so essentially a detailed plan of what it will include and how it will be delivered. And thanks to West Yorkshire ICB, we have funding to build this. So it'll be a website with resources and videos covering all the key areas we've identified from our research around toothbrushing, healthy eating and drinking, and going to the dentist. Alongside this as well, it'll have free training for professionals so that they feel confident engaging in these oral health conversations. So toothPASTE will be ready in autumn 2024, freely accessible for families without the need for a formal diagnosis, and to all early year professionals, not just those within healthcare. So really building on that whole system implementation plan. Now, we know educational settings can play a really major role in supporting autistic children. So we're working with the Autism Education Trust, as well as local authorities and stakeholders, to maximise the awareness of the support package so that 1, schools can share the toothPASTE resources with parents, and 2, have access to autism oral health training that's tailored in that space. And we know that some schools and nurseries run toothbrushing clubs for children aged 3 to 5. And so a separate project within our research group, the Brush Toolkit, has been developed specifically for those toothbrushing clubs, and toothPASTE will directly link to Brush to ensure it is autism inclusive. And thirdly, there is some space to link schools with local dental practices. We're very much aware that dental access is a problem, so we're kind of working on how we can do this. And we really want to work on our partnership and build a whole system approach to improve autism support with and through educational settings. Thank you very much.
Thank you. So that wraps up all of our presentations today. Thank you so much to our presenters. As mentioned at the beginning of the webinar, we do have a few questions submitted by schools, and we have 5 total and about 5 minutes remaining. So if I could ask our panelists to keep responses to about a minute each. I'll start with a question for Sarah. Please, can you let us know what can schools be doing to best support their students, given pressures and time constraints of the classroom?
I'd ask them, that would be my first response, ask autistic girls or any autistic student, how would you like to be supported? I think often autistic youngsters don't want to stand out, they want to blend in, they don't want to do anything that's going to attract too much attention. So I think talk to them about how they would like to be supported, and listen to what they say. because obviously they will sometimes have really quite strong views about how and by whom they would like to be supported. And I think if it's all possible, give them a choice, because actually, you know, you might think that this person is really amazing and really great to work with this young person, and they may wear perfume or deodorant that drives the young person absolutely crackers, and they can't actually sit next to them, for example. So that would be what I would suggest as an easy kind of fix. I think longer term, there are lots of pressures and constraints in classrooms, and ultimately mainstream schools will have to be a bit more flexible. I think not massively flexible, but I do think there needs to be some flexibility to ensure that autistic young people can be successful in mainstream schools, because you know mainstream schools aren't designed for them, and they do need to change and adapt to really be inclusive settings.
Thank you. That's really helpful. Leanne, the next question will be for you, please. Can you let us know what would you recommend for schools to do to meet the needs of autistic girls specifically?
Yeah, thank you. That moves on quite nicely from Sarah's response, actually, because that was exactly one of the things that I was going to say about actually speaking to the girls themselves about what they need and what what support is going to be helpful. I think that's one of the main things that came out of the research, was that actually they very often know what is going to be helpful and unhelpful, but particularly in mainstream settings, sometimes it's difficult to have that kind of consistency and trusting relationships to be able to then share what it is that they need. So it spoke about you know, being able to build those relationships with a particular teacher or adult in school, but just naturally being, you know, transitioning through the year groups means those relationships are disrupted a little bit. So yeah, creating, I guess, environments where they're able to share what they need. And I guess the other thing that came up was the idea of you know, parents sharing concerns with schools. And I guess that being a bit of a trigger to think about, okay, what is going on here? So if parents are saying, you know, she's really anxious, she meltdowns at home, really difficult to get into school, but you're not seeing that in the classroom, then that in itself being a bit of a trigger to think, why are they struggling so much, but we're not seeing it? And then that, you know, we talked about kind of partnership working and working together with health and education and families to avoid kind of working in silo, but really develop like a big picture understanding of what is actually going on and being able to identify holistic needs.
Okay, thank you. That's very helpful. Our next question will be for both Caroline and Ray. Can you tell us what actions are currently being taken to increase the capacity of educational psychologists in the short term, if anything?
Well, I think everybody's aware that there has been a new contract come out for educational psychology training. So the numbers are going to go up from 123 people being trained per year to 139 people trained per year across all areas except London and South East. So there has been an increase, and the last contract also represented an increase. I'm aware that that's still not enough, because post-COVID particularly, there's been a lot more demand for educational psychology. I think one of the more innovative things that's been happening is a growth in assistant educational psychologists who work with the support of fully qualified EPs, and there's a lot of work that they can do. So things like kind of training, some aspects of assessment, running some interventions, which again can help schools to kind of build their capacity and to be able to kind of build evidence if they need it for requesting further support.
Thank you. Our fourth question will then be for Amrit on the topic of oral health. Can you tell us, so you mentioned the brush toolkit, but what's one thing schools can do for children's oral health that won't require any additional cost?
Yeah, so I think one key thing is that when schools do identify children who have additional sensitivities or need, is to share the toothPASTE website and resources when it is available, because it's all about that early support and being needs led. So whether it's around how to gradually introduce toothbrushing or having some potential solutions to challenges that parents may have. So for example, a different toothpaste is like non-flavorless toothpaste as an example. But because it is parent led, it's hearing from lived experience and not just advice coming from us. So yeah, definitely sharing toothpaste, but also school staff undertaking that toothpaste training as well, because again, it's free of charge, but with evidence-based and trusted content developed in partnership with parents early year professionals and dentists at the University of Leeds. So schools can feel more confident to answer them parent questions, whether that's around toothbrushing, going to the dentist, or limiting sugary foods and drinks, because we're aware that them conversations do happen at the school gate, but there'll also be content on there around toothbrushing clubs, linking back to brush, like you mentioned, and adaptations that can be made in the in that dinner hall around, and other content that schools can use in this space. So being aware of toothpaste, being aware of the toothpaste website and resources, and actually using it as well could be one of the key things that schools can do that doesn't require that additional cost.
Thank you. And we'd be happy to circulate via the CARE network any sort of resources that we can. Our fifth and final question will be for Evie. And Evie, our schools would like to know how they can get involved in the innovative approaches referenced in the report.
Yes, so some of these will be detailed on the CARE website, but for other innovative approaches, people can get in contact with us via the CARE email address, which will be on the next slide, and then we can initiate any connections and point people in the right directions and help support with that.
Thank you, Evie. So I want to thank all of our speakers today for their presentations. I think it was a fantastic lineup of speakers. And I want to say a special thanks to Evie. Without her support and coordination, this webinar wouldn't be taking place today. So thank you, Evie. We will circulate a recording of the webinar, and we welcome questions by email at carebradford@gmail.com. We do hope everyone will join us for future webinars in this series. In the next month or so, we'll plan on webinars focused on a range of topics, including childhood poverty, health in schools, and children and young people's mental health. So please keep a lookout for the dates and times of upcoming webinars by email and on Twitter. So thank you so much, everyone, and hope to see you again next month.